That is how we refer to it. There's open pods like we had at the convention center. There's closed pods like we helped, say, Cook Incorporated or Cadlant do during COVID. Pandemic flu and highly infectious respiratory diseases. This is one that is very, very detailed, is definitely needing to have a lot of review. But it's just all those specific things like epidemiology. What does the state do? What do our nurses do? What do we do? And again, COVID was a great example because while we were setting up testing sites, vaccination sites, there was so much more that went into it. I mean, that was just like a small piece. So that plan really gets into that, all the other things that go along with the pandemic. And then isolation and quarantine, that's just how we would respond to, more specifically about those situations where people are needing to be isolated or quarantined. And I believe even gets into some of the legal aspects of that. Let's see here. And so just one final thing I just wanted to mention, I talked briefly the phases of public health emergency management being mitigation, preparedness, response, and recovery. And I just wanted to give a couple examples. So mitigation, that's, providing immunizations, providing public health awareness programs, health inspection. So that's that mitigation component of it. Preparedness, it's having plans, having, backups of supplies, having a way to, again, function outside of this physical building. Response, using our staff as necessary and moving them to where we need them in our incident command structure. Initiating disease control operations, sanitation activities, and so forth. Also setting up pods, things like that. And then recovery is, kind of returning back to normal and, looking at were we compliant with everything? What needed to be done that we didn't do, or what did we do well? Having a hot wash, an after action report and improvement plan so we can do things better. Deactivating shelters, getting things back to normal, supplies, staff, and so forth. So there's lots of other little pieces, again, of these plans. They just go on and on and on with the annexes and the appendices and so forth. And if you're ever more interested in a specific plan, I'm happy to review that at any point. But do you have any questions?
How, at what point does something like the County Emergency Management Office interact with the health department?
We have a very close relationship, and as far as I know, always have. So I actually communicate with them on a weekly basis. I was just communicating with Justin, for example, today about some things. They would reach out to us, for example, during the tornado, when we were looking at having the multi-agency resource center set up with, having the state come to do some tetanus shots and vital records to be there, the state vital records. So we work on things like that. But
so there are many different points of
yes,
interaction.
Absolutely. Okay. Yeah, I would say they're probably our closest partner that I communicate with all the time and very freely. And they're super easy to work with. Any other questions?
Thank you.
Okay, thank you.
You're a busy bee.
Lots to do.
Yeah, there are lots of things. Thanks, Christina. That was great.
Thank you.
Kevin? You're up.
Hi, everybody. My name is Evan Tice. I'm the clinic manager of Futures Family Planning. I started the end of June 26th to be exact. So I can't answer your questions exactly. I apologize. Still learning the position. But I do have several points to go over, just three main ones. And then I wanted to touch on the Indiana Family Health Council's goals for us, and then just open it up to questions and comments. I typically do better being prompted, and I have a feeling that y'all might have some questions about futures. But the first point is just to express gratitude. I think your guys' work and jobs are amazing and easily gets overlooked, so just wanted to call attention to that. But the very first point is just the advisory board, or it's also called the Information and Education Committee. To my knowledge, they haven't met since March of 2023. It's expected of us to return the minutes of at least one INE is what it's called, meetings, to the Indiana Family Health Council as part of our quarterly reports. Because the meeting in March, I don't believe that it was reported, and we haven't met since then. I'm not positive that it has been reported during this year, but just worked closely with Lori about trying to just send out the initial invitation and just gauge response on previous members. There were a small handful of members that weren't invited, but were kind of like people they thought about joining. So I think that may be a bit for you guys to come and help a little bit, just if you had members of the community that you felt were worthwhile. I'm trying to reach out to them the best I can, but our goal is to get them by at least the beginning of 2024. We have our comprehensive audit with Indiana Family Health Council, I believe February 15th, but it's early February. It's a financial, clinical, and administrative audits. So I want to make sure that we were safe and sound before we started inviting people in with the advisory board, but I also recognize the support that it can provide to futures. So that's one of my top goals. If you guys aren't familiar, the advisory board largely just approves handouts, patient education. They discuss family planning projects like Path for You, which is one of my other points. But like I said, generally the expectations are low. We're just supposed to report meeting minutes. The next point is just telehealth. I'm sure you guys have heard about that here or there, but we do have a flow template and a few other resources that were made available to us just within our drive. The telehealth template was actually made by Pace. I've spoken with Michelle Pitcher. She's the clinical services director for Pace. She mentioned that relatively speaking, the numbers were low for telehealth, but she was a great resource in terms of like what to expect in the future and what steps we should take. The first step that we took was just getting our nurse practitioners licensure up to date. Which I believe we just need to send to PLA and like get the paperwork done for that. But that's like the first thing that we've done. Like future steps generally just we're trying to focus on policy and grant guideline adequacy, making sure we're meeting the demands, and then just how we can implement it, and just methods of managing the flow. And it's a new thing for us just at futures, but not for us as employees. So I'm excited to see where it goes, but also just looking for support generally on implementation methods. Like I said, the metrics are pretty low. Michelle mentioned that they had less than 5 patients per month on telehealth. I believe only 3 of their 5 providers do telehealth, so that could be part of the reason, but they were 5 clinics, we were only 1, so I'm not sure what to expect with that, but I'm looking forward to it. I do plan on shadowing at Bedford with the nurse practitioner to hopefully discuss just challenges that they faced, successes that they found, and ways around that. And then the last point is just Path for You, which I have a feeling you guys will probably hear a lot more about because I saw in the packet much of the contractual work is on today's agenda. Most of the steps that we've taken are just meeting with Path for You, hammering out some of the kinks. A lot of the meetings have just been to discuss integration. They already have many clinics that see many patients. So the process is relatively streamlined. It's just more about I think, participant recruitment, more so. But they did have some concerns with like the billing and coding, some of like statistics, but we've had meetings over that, and I think they're relatively available in future terms. So I'm not too concerned with that matter. When speaking with Michelle, I also asked about their metrics for Path for You. She said they see generally less than 10 patients per month, directly from Path for You. If you guys aren't familiar, sometimes Path for You, people approach them directly through their website, or they have like a birth control navigation tool. They said that was pretty low. More often than not, it's mostly patients who are transferred into the study to save service costs. She said that's roughly 10 to 20 per month. My last point really is just some personal goals, I guess, and then I'll get to the IFHC goals. I generally just want to increase our efforts for DEI, inventory management, updating our patient portal, clinic accessibility, updating our policy and procedure book. I think all of these things will help meet the goals that IFHC's laid out for us, including telehealth and Path for You. That is their main goals. The first one is just to increase telehealth by 2%. The second one is just to increase adolescent visits by 3%. And annually to have 80% of our patients under 25 tested for chlamydia. Most of those metrics were pretty close to meeting if we aren't already. But I do think it's worth mentioning, but there's been a lot of staff overturn. Obviously, post-COVID, we haven't met same numbers pre-COVID, so just a lot of new things for us to learn, but I think we worked pretty well as a team. I'm excited to see where things go, but be happy to open things up for questions, comments, concerns if there's something.
Do you sense that the community at large knows about futures, and do we need to be broadcasting it more broadly?
Yeah, I think we have a relatively strong referral network. We work really closely with DIS, disease intervention specialists, even like HealthNet. A lot of our referrals come from even PauseLink. We work really closely, I think, with our community, and I think that alone has been helpful. Like I said, I'm new, so I'm not like I can't speak to like what's been done in the past, but even I used to work at Planned Parenthood for almost 2 years before this, so I referred patients, to Path or to Futures. Like we were aware generally of the title and clinic, but I think certainly the transition from Peggy to our new nurse practitioner has been difficult, especially just with Peggy. I know she had increased visit times on her way out. And then, sorry, I want to make sure I answered your question.
Well, I just wanted to know whether we needed to let more people know whether it's about communicating with the township trustees to let them know that this is a great place to send people who are in need of services. I don't know how broadly the community is aware of Futures.
Well, to be quite honest, I don't. I think that mentioning that period is worthwhile. If they don't know about it, then it's a good opportunity to teach them. If they do, then everybody knows somebody that I think that could benefit from the services. If they don't, it's people they work with, their clients they see, or all the above. So I do think it's worthwhile mentioning if you guys don't, but it's certainly understandable why. I think things certainly have slowed down. With the Path for You, I think we'll speed up just a little bit. I know that they have some like swag, I think is the word that they use, like just posters and things to post on our social media. Generally our metrics for social media are relatively low, so I think that could be another avenue to spread awareness for sure.
And also, is our educational coordinator trying to help to get that adolescent number up?
Good question. The school liaison is a,
Yeah.
I'm not quite sure, I'm not familiar.
We could definitely, I think, work with Lisa on that.
I do know that the social worker for MCCSC reached out to me. I sent them PDFs of our pamphlet. So generally, to my knowledge, I'm sure that they're relatively aware, but I think it's worthwhile investing in. Because Allison, I think especially with telehealth, it may help a little bit. Just in terms of like accessibility, but potentially bad for you as well. It gets people on free birth control, and especially adolescents. I think many of our patients who are adolescents are that's what I'm looking for. Confidential, like they're not comfortable using their insurance, or they don't want their parents to know, even college students. So I think that's certainly for them.
Evan, how's our utilization for the hours that we're open? Are we busy there all the time? Or we can see more people, right?
Yeah, I
Yeah.
think so. On average, we see per schedule generally about 6 patients per day, 1 per hour. I think a lot of that, I was kind of expecting this question. I think a lot of that is complexity of visit. We often spend over an hour with our patients, and additionally, just getting patients to come in the door. We can schedule patients all day, but they might not show up, right? So I think it's certainly worth investing in that. But I mentioned one of my personal goals is patient portal. Texting our patients, emailing them, calling them, like sometimes doesn't suffice. Oftentimes our patients' numbers change, or they use services that might expire, for example. So I do think that's a good question. But I think especially with telehealth and Path for You, it brings a lot of opportunity to break apart this complexity that we're seeing in appointments. I think from IFHC, we get a lot of, maybe not a lot of pressure, but it's encouraged that we approach our patients with complexity, because we're aware that that might be the only time that they see a provider. Even that year, oftentimes people's OBGYNs are their only physician, especially our patient populace. So I appreciate that our nurse practitioner values the complexity of these patients and things, the concerns they're presenting with. And to be fair too, a lot of referrals get made via that. And so I think it strengthens our community bonds and whatnot. But I do think the advisory board and creating that, I think, will hopefully bring support with that in the future. So.
What kind of resources or things do you need for telehealth to take off? Since I know we're currently not doing telehealth, it should be easy to increase 2%. We have to see one person.
So I think first off is, like I mentioned, just implementing it, trying to find effective ways. I think
is the hardware actually set up? I mean, do we have all of that set?
I'm not positive. I'm not a provider, so I'm not familiar exactly what steps need to be taken from that perspective. I know we have computers and cameras, and I do believe there is like generally some telehealth functions with iSalus. I'm not exactly positive, but I do know our nurse practitioner's done it before. She's familiar with telehealth. Like I've worked at Planned Parenthood, we did telehealth like nobody's business. So I do think that it will certainly help. In resources, I think breaking up the complexity will help.
I mean, really what I'm driving at, do you need IT help? Do you need this, you need to get the just physical plant set up so that you can begin to, set up and I don't know who takes care of that. We have.
Well, from my understanding, the grant agency gave us a laptop. And so it should have all of that pre-installed on it, but we would probably want to work with TSD.
It needs to be integrated with iSalus, so. And that may be a catching point. I don't know, does Emma have experience with it?
Yeah, I think it's called BetterDoc or TeleDoc or.
Don't we have support with iSalus? Do we pay for support?
They have a support team. I'm not sure that we pay for it, but they're relatively available. I know that they have trainings that we pay for.
Yeah, there's any program you're going to pay for, you pay for the support. Yeah.
Right. Well, I do believe they have telehealth support training. We haven't done that yet.
I'm just trying to figure out what we need to do to get the ball rolling on that, since we have a metric, that's will be measured in our review, so we kind of want to do what we can here, so.
It seems to me if we have the equipment, but people haven't been trained, the first step would be requiring everybody to be trained.
Okay.
And then I would also guess that since he said Planned Parenthood does this like nobody's business, we need to find out why they're successful and what we need to, because clearly it's not an impossible job, right?
Oh, yeah, sure.
And I think if we promote it big time, you should see a lot more numbers, but it sounds to me like nothing has really been done, so I'm hoping.
Yeah.
Now
Not
that
placing
you're, now
blame,
that you're
just-
here.
We're just trying
No,
to,
I mean,
we're trying to
I mean,
brainstorm here
of
what we
course,
need to do
I'm
together.
hoping now that you're
Yeah.
here, those things can start happening.
Yeah.
I will say too, Planned Parenthood also invested probably millions of dollars in an education department and an IT department, in a training department to ensure that their staff were doing it efficiently. They were seeing triple the amount of patients that we see, because they were investing in it. So
The regional office,
it's about,
the regional Planned Parenthood, I'm guessing you don't mean you mean Bloomington did. Okay,
yeah, we
So-
had telehealth days.
so that would be something that with all of the new money we're gonna get, should we all want to prioritize that? That would be great, probably a great way to spend the money, the Health First money.
But was it Pink that actually invested the millions? Or was it specifically the Bloomington office that?
I'm not exactly sure. When I worked there, it was Planned Parenthood of Great Northwest, Hawaii, Alaska, Indiana, and Kentucky. So it was, right, it was after.
Diverse.
Right, a mouthful, but I think as long as I worked there, it was during COVID, so telehealth was relatively
Sure.
emphasized. Because we had states in Washington, they were relatively progressive and, we're very comfortable investing money in technology. The way it flowed there at least was that patients still came. It was relatively like a nurse day. They would come in, leave their samples for the visit that they were being seen for, talk to the provider over the computer that we had in office. So I think in terms of like hardware, that could certainly be beneficial. With the implementation struggles, that's what we're trying to find is how it makes sense scheduling and billing and coding, let alone if we're seeing them separately, or I know that,
But first you gotta be able to do it, so that, it's like you put the cart before the horse. I mean, you need to be able to have this capability set up and then figure out, who you're gonna bill and, and those things,
Right.
but if we still don't really have the capability of doing it because we don't really have integration with, for instance, our program and the other things. So I'm just trying to figure out what we need to do to give you the help that you need to get this ball rolling here.
And
'Cause
couldn't or shouldn't IFHC be providing guidance on billing and coding?
it's,
'Cause it's their grant requirement, right? And so since it's for all the Title X clinics, I would think that would be their responsibility.
right, like I said, I spoke with Pace, excuse me, and Michelle from Pace specifically. I know that they see telehealth patients. I wouldn't say frequently, but it's 3 of their 5 clinics, so I do think that they receive support, I'm sure, from IFHC, but Pace is also managed by, a separate incorporation, so I'm not exactly sure, I can't speak to that, but even to say as well, I'm aware that telehealth is not an old thing, but it's been something that we've been trying to implement, so I'm not exactly sure what support has been extended and, what that looks like. But I'm certainly happy to reach out to IFHC and see if they can provide any support for next steps.
Good, great.
Any other questions?
If we have suggestions for the advisory board members, would we contact you directly? What would you
Yeah,
like?
or Futures has an email, it's just futures@co.monroe, so that certainly works as well. Or you could even call. Probably.
Any other questions for Evan? No? Thanks, Evan.
Thank you.
Good report. Yeah. Lori?
Me.
Yeah.
I was able to come up with a few
Okay,
today
all
before
right,
the
okay.
meeting, so
No.
I apologize for not sending it out before.
That's right.
So with our wastewater section, installation season is winding down. Cheyenne Cox is working with Jeff Cockrell, one of the attorneys, on using extra county funds for failing septic systems in the county. She's meeting and working also with stormwater to focus on high areas of concern for failing systems. So hopefully more information to come on that soon. With our foods division, the new senior foods lead is starting on November 20th. Foods is hoping to increase mobile food inspections in 2024. They are currently getting ready for the winter's market. And they're on track to complete all of their level 2 and 3 restaurant inspections. In general environmental, a lead analyzer has been ordered, so that should be on the way. So our public health clinic is pretty excited about that. This will be able to provide instant test results rather than waiting to send those off to a lab and get the results later. General has been working a lot with Sally for lead risk assessments. Cody and Simeon completed a webinar on radon and cancer. So we've purchased 25 radon kits and looking to beef up that program as one of the goals for 2024.
Do we still have the radon thing that anyone can pick up from the department and take to their home for just
That's
2,
what we're
3 days?
That's what we're starting back up.
Okay,
So we've got 25 and then we'll have more coming in 2024. They're working on creating a form for the website. People can go onto the website, complete that form, submit it, come into the department, pick up the kit. And then Cody and Simeon will work with the individuals for the results.
because I know at one time we had the kits that you could pick up and then you sealed it and sent it away,
Mhm,
or you had the electronic device that you could borrow, because I
mhm.
borrowed it
Oh.
a couple times, actually.
Yeah, so same concept from my understanding.
Yeah.
Yeah, I just don't think that it's been done for a while. Let's see, harm reduction. So onboarding the new harm reduction specialist is going well. They're looking to begin increasing their testing once the training has been completed. The CHIP groups, substance use and mental health group, had a final meeting on November 14th. In 2024, those groups are going to recombine to form the Suicide Overdose Fatality Review Action Team. Inequity, Discrimination, and Bias Group plan to continue engaging via an email list for support on the community health assessment that will be starting in 2024. Melanie and Kathy are setting up interviews for interns. So this will be an undergrad, correct?
We're interviewing one undergrad and one graduate student right now, so we have selected.
Okay. Melanie was invited to join the Mental Health America board. So I thought that was pretty exciting. And with vital records, the registrar is working with the financial manager and TSD for implementation of a new online payment system, which will be through OpenGov for permits, so for environmental. So a little bit of a bumpy process there, but we're working to get that started. And council recently approved a new position, so we'll be able to post for another health educator. This will be the behavioral health and wellness coordinator, beginning sometime in 2024.
Great. Any questions for Lori?
Yeah, can you tell me if you resolved the hostile incident?
Yes, thank you.
Oh, you mean the septic?
Yes, yes.
Yes, and from my understanding, Mike did contact legal as well. So if they need to go out again, they can have a police escort.
Okay, thank you.
And making sure that they're going out together, which we generally try to do that anyways, just for safety reasons.
Is there any way
Such
to
as
know ahead of time what kind of a hornet's nest you're getting into?
Well, I mean, I think somewhat. I think sometimes can look up certain information, you know, to kind of be able
They should
to
do a
have it.
background check on everybody who
Yeah.
inspect.
Um, I feel like they've done that though in the
Okay.
past, just because of situations like this.
Yeah,
Well, and it's a complaint they're investigating, so
Mhm.
you can kind of tell a little, sometimes from the complaint itself, sometimes.
But yeah, they just stayed, they didn't go up to the house again when they went back out the second day. Just the external property, so. Thank you.
Thanks, Morgan. Okay, let's move on. We're old business. I contacted the Angie Purdy at the commissioner's office last week. I actually sent her an email to ask her if there's been any information on new board members, and to quote her, "Oof, it's a desert out there." In other words, we still don't have any information from either the county council or the mayor's office.
Do they know we're all old and we're all gonna die?
Well, I did speak to one of the council members, at the luncheon the other day, and she said, we just don't know enough Republicans that would fit the bill. And that's the limit that the boards are running up against. So anyone who has any suggestions about Republicans that would.
Well, what about the pediatrician that was a Republican with IU Health, that Dr. Chalukian?
And as
Yeah.
I recall, that she withdrew because she had health concerns in the family, is what I remember.
No.
No,
that was
was-
She was, yeah, that was a different person.
Different.
I
She
mean,
was an
IU Health
anesthesiologist.
Really would
Okay.
like
Yeah.
someone
don't need
IU
another
Health
one
on the
of
board too.
Yeah.
Be a pediatrician, that was just a thought.
Well, it would be nice to have somebody, if we're having another physician, it'd be nice to have someone in primary care, I think.
I
It would be
think primary
nice.
care too. If we're having another physician, I'd rather have.
And also have pharmacists and dentists and. all sorts
Yeah,
of
I'd rather
people.
have other
And, yeah,
allied health professionals or
And.
Well,
things,
it's-
but it sounds like we don't have much choice
Yeah,
in what we would like to
Maybe-
wish for.
You know, I
So-
have someone that maybe the council would consider, because this person is being retired is an actual asset for this board, because you have time to spend. Especially this last few weeks. You know, if somebody's working, I thought, I don't know how somebody would be doing all this. But I actually have he's a retired oral surgeon, recently retired, who I think is a Republican, and maybe I
Might have
can
a
ask him,
chat.
I'll have him call you.
Sure, that would be wonderful, you know, and if this person's interested, then I can direct them to our council president.
Sure.
Yeah.
I can talk to William Ellis, who's head of the Republican Party in Bloomington.
Oh, that's an
See if he
Yeah.
has any thoughts.
Boy, why did we not think of that? Thank you.
let's think about that
Thank
today, so
you.
I can just approached Republicans.
Yeah.
and find out. Cause they've got the whole list.
Yeah, maybe they can put something in a newsletter, however they communicate with members.
They have regular meetings, monthly or better.
Okay, that sounds like a great.
But
way
they
to
also
go.
have access to the actual polls and can get into the voting histories of everyone, and so they
Right.
know who has voted Republican, which is the things that you have to have voted Republican in the last primary. So they can access that fairly easily.
Could they be a libertarian?
I think they have to be a
They
Republican.
have to vote,
They have to be. a Republican.
they have to vote with Republican.
Okay.
Registered in the last primary as a
as a
Republican.
Republican.
Okay.
And 4 of the members of the board have at least to be members of the other party. I think that's how the rules are written.
Well,
Okay.
thank you for following up, Steve.
Yeah, I checked, so we don't have nothing to report there at this time, so. Now we're getting into the meat or,
Oh.
Aaron, I'm gonna need help with all this.
Oh, no. Well, that's why we have Kim.
You want to come over here?
Sure.
Come on down.
I'll just,
May
whenever
I,
you guys need to ask a question.
may I ask a procedural question before we start with all this?
Sure.
Do we need to go through every word of every red thing?
No,
I
Like,
don't think so.
okay, I'm praying we don't.
it's been hashed out.
It's been hashed out, right?
Yes.
And people who need to feel comfortable with it, feel comfortable with it.
As far as I know, we've made some of this
Okay,
updates. Mhm.
okay. All right,
All right, so the first one in my list would be the registrar
that's the first, I think, on our, in our
Yeah.
packet.
in our packet.
I saw two problems that I read in there. And I pull it up on the, tell you, but I can't tell you that on page 2. You want these?
I was gonna say, does somebody have a pen I could borrow?
Yeah, please write on that.
Yeah.
It's not this- this one. Page 2. Okay, on page 2 of it, it repeats, takes applications, right after the supervisors is Xed out. The takes applications is also in red above all of that, so this is redundant. Are you seeing where I am? On page 2 of the registrars.
I'm seeing where you are. I don't see where it is in red, Sarah.
Okay, well, that's when I read it,
Another copy we got.
unless
Well,
it's
just
changed.
just say it again, say what,
It's the bottom part from page 1.
So,
because I'm,
so on the bottom of page 1, it says, receives applications for food licensure, blah, 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 blah. Then when you turn to page 2, after you X out the supervisors assigned personnel, including, it repeats that takes applications and
yeah.
records, so it's redundant.
that part.
Well,
It's,
at least we're not missing that.
it's not completely duplicative, but it's saying the
pretty
same
damn
thing.
close.
It's saying the same thing.
Yeah.
So since the red looks newer, probably the smart
That's-
thing would be
yeah.
to take out what's in black.
Exactly, that's why I thought I'd bring it up.
Like I said.
Licenses were listed.
So
Where's she at?
We want to remove this.
And we're on the registrar, right?
Yep,
Sorry.
Registrar. Go under the stuff that was Xed out. The Xed out part starts with supervisors assigned personnel.
Yeah.
I'm on the assistant, that's why.
Oh,
It's like,
well, then
none of this
that
making
won't do
sense. Yeah, so it's like, what?
For the registrar.
There we go, sorry.
Yeah,
All
Right
right,
there.
okay, so
Good
take this
catch.
one
Remove
out,
that.
okay.
Okay, and the only other weird thing that I saw, oh, but it's in a different. Oh, yeah, so on page 3. I was confused because, when you get into health, you see in bright red in the middle of the page, health administrator for review and approval, and then it says forwards auditor, and I thought, well, where are we gonna forward the auditor?
Yeah,
to?
I was confused on that, just. the
Where does the
sentence.
auditor want to
I
go?
don't know.
Hawaii? We can forward the
I just
auditor to
thought
Hawaii.
that's
It should be, it should have
Said-
said
said
forwards
forwards
to the auditor,
Yeah.
yeah,
To
But
the
forwards auditor didn't make
Yeah.
much sense to me.
forwards to,
missing language.
okay.
Thank you for reading that so thoroughly.
A lot of it I didn't, but
You're better than me.
those were the only ones with the.
So
and that
do
was
it.
it. So,
Requisition by some-
yes,
Per
we need to vote on
each
each one.
one.
of these.
Okay,
Yes.
Thank you.
Now,
All right,
I would like to just make a general statement if that's okay.
sure, absolutely.
So I've been working with Dr. Breton and Lori as well as county legal for several months on these. And so, yeah, just like you saw, this was, a mistake. And so before I send them off, I always try to do one last review. So this is good. And thank you. I appreciate that. Just so that you know the process, when you do the job descriptions, these are to be tailored to the position and not a person. So, because otherwise, if you're trying to tailor a job description to a person, we would just be continually making changes to job descriptions. So when you look at these, is this what the health department needs for this position to do? And I believe, because we've had Lori, we've had county legal, we've had Dr. Britton, as well as myself, we have thoroughly vetted these. And I think these are a good product. And I think my opinion is that you approve them all. Because there was a mention that, you approve one or approve them all except for maybe one. If you do that, because we have overlapping duties, we have overlapping, we have backups and this kind of thing. That kind of halts the process because WIS won't start reviewing until they have the whole batch. So if you want to wait, I would wait the entire batch, or you're going to do them all. And that was just, my 2 cents worth, so that you know kind of what's going on.
That's helpful. So then it sounds like my question is, we should not be doing it one by one. We should do it as a.
We can look at them one by one, but we want to vote on the whole package.
Okay. And that's okay.
Yes, but
Okay.
you
'Cause I
can
know
vote
when-
on them one by
Because I
one.
know that
It was okay.
if
for
we
us
were
to do
reviewing
that. We'd
policies, you
rather-
can't do that. You
rather
have to
do it as a
review
batch.
policies.
Yeah, unless somebody says, no, I absolutely want to pull one out.
We are not gonna say that. We are not.
Okay.
I did have a question as I read through them, and in many cases it says things, for instance, the administrative assistant will assist with this, this, and this.
Mhm.
Now, the question is, in its corresponding department, so if the administrative assistant is helping with the financial piece, does the financial piece then need to say, we'll keep administrative assistant up to date on any changes, blah, blah, blah? That's the part that I wasn't clear about.
That's up to your administrator
Okay,
on how
perfect.
often they want this administrative assistant and or anyone else, anything else to work with whoever. We have a backup, and I'm just using this as we have a backup in payroll. That person that's going to be doing the backup in payroll, and I only know this because it was mentioned at a meeting, is that the backup will be doing physical payroll quarterly. That way they know what's going on, they could remember the process. So however your administrator and or, Dr. Britton would like for this schedule to happen, that's totally on them.
I guess I was asking because I know what a kerfuffle it was when Lori was trying to deal with getting people to cross-train and just cooperate.
Mm-hmm.
And I didn't know whether we needed to put this into the documents or not.
No, the
Okay.
job descriptions are supposed to be kind of vague. I mean,
Good.
they lay out the actual duties, but the
Specifically
very
vague.
specific
Yeah.
duties,
Yeah.
details is up to the administrator or department head. So
That's
that's
what I
how that
wanted to
works.
And I would just assume like the esprit de corps, that, everyone helps everybody else in an office when it's needed, so.
That's in the best of all possible worlds.
Yes.
And it says performs related duties as assigned.
Right. And, I mean, and so if something happens in one department and they need somebody to run over there, she's got discretion. Dr. Britton has discretion to say, I need you to go help. So that's why we always put or try to put them, as assigned by the administrator or at the direct, discretion.
Perfect,
So-
I feel much better about that.
So we have 5
Oh, gosh, I thought more than.
More.
Well, we have,
Well,
we have 8, including the nurse
Yeah.
practitioner, the people in the futures clinic.
Just for one more clarity, the ones with regards to administration have already been to PAC. And so whatever you approve, for those will immediately move on to WIS. Now, the clinic
Futures.
ones, the future clinic ones, we worked on, still have not been to PAC. So that will be, if you approve those, then they're gonna go to PAC. So for approval to move forward, so.
So we don't need to approve them separately. We can.
No, you can approve.
Okay.
them.
That's a bad.
Okay.
Yeah, approve,
So,
approve. you know.
Does it make sense as a way for us to work through this, since there are so many, and since they've been looked at by so many people and worked on? Should we approach this not individual, but a general, like, because I know you're good at picking up errors, you're good at picking up errors. Should we just say, are there any things that people found or have concerns about or questions about, and then be done with it?
Yeah, it sounds good to me.
It's whatever you want to do.
Because I have a question on the administrative assistant, and it's a word. And again, it's like, is this the wrong word? Or is this a word I just don't know?
Okay.
Under duties, second paragraph, assists the health administrator, the summary of annual statistics. And I assume it was statistics.
Statistics, that
Yeah,
was
that's
just,
just
I think
I
that's
knew
just
it was just a, yeah,
a typo.
That's a typo.
but it's one of those, we
Okay.
probably
Mhm.
want to at least correct it. Great.
All right. And I think that was probably, I was one of the, and I'm trying to
Yeah.
type on the fly when I was working with them, so.
Well, that's why.
And it didn't,
That's why
and it
it's
didn't.
good to have
prove
some
it. Yeah.
people
you made a
looking
mistake.
at it.
You make a mistake? No,
Say it
never.
isn't so.
No. So, no, that's awesome.
Okay,
Me to
Any-
interject, but I can certainly reprioritize the job description if that's something you guys would like.
Say what?
Because the future is, I would, if I'm expected to add anything to the job description, it has just fallen off my radar a little bit. So if I need to reprioritize it, I certainly will.
I think Dr. Britton and I met, and I think that we're okay with going through all the details and stuff and everything. Mhm.
okay, so are there any other, I'm scrolling. Kay, did you find any typos or anything?
No, I didn't. I was reading it on the computer and I'm not as good catching things on the computer as I am on paper. But I did have something that it's a touchy thing to bring up. Under educational requirements.
Which job, which one are you
Okay.
in?
Let me get there. For
Okay.
instance, and I'm looking at our chart, our
Mhm.
organizational chart, okay? Now, when I look at the organizational chart, I see that the nurse practitioners report. Oh, where are they here?
Left side.
Left side.
Left side, they report to whom?
Well, we changed that because of,
There they are.
we changed that and it's listed on the job description. They will report to the medical director with
Okay.
regards to any medical procedures. They will then only report to the clinic manager with regards to administrative. So that would be if they need a day
Okay, that
off.
took care of it.
Okay,
Because under job description for the clinic manager, for educational requirements, it was very broad, like even GED with minimum 6 years experience and so
Mhm.
forth. But under the nurse practitioners, they had to have a master's and they had to have a certificate for
Mhm.
basic life support. And I couldn't see how the nurse practitioners were only reporting to the clinic managers.
are
Yeah,
they?
It's
Is it-
outlined here pretty
Yeah,
clearly.
yes, it
Yeah,
is.
and so-
It's been
Good.
fixed.
And we also fixed that in the job description, so not only on the.
Yep.
That, so we took
Okay.
care of it.
Good.
Okay, so,
That's what bothers
because that
me.
was one of my concerns is it had immediate supervisor, health administrator, and health medical director. And And WIS's says they can't have two supervisors
Right.
because what if he says yes, she says
Right,
no.
right,
So we delineated and that way it.
So I am not gonna be approving vacations.
Okay. So we have 8 job descriptions to approve, and are there any further questions, typographical errors, or omissions or additions? Maybe not addition, but any other changes anybody wants to have? Then I would.
I would move to approve the job descriptions.
Perfect.
Thank you.
It's been moved and seconded to approve the job descriptions. Any further discussion? Seeing none, all those in favor, please say aye.
Aye.
Opposed? Motion passes.
Yay, we got something done.
Yay.
Kim, we thank you for coming.
Kim, that was, yeah, you made it relatively painless. Thank you.
Well,
Yeah,
so,
thank
you
you
know,
for clarifying.
It was painless to go through it, and I can
It-
imagine writing it.
It's been a struggle because when we would start on one job description and it's like, okay, if we're gonna move this, then we need to pull open this one.
A lot
So,
of
I mean,
overlap.
it was a lot of overlap and I appreciate these two coming out and, you know, I think we did a good job and Molly
Good
couldn't
job.
make it, but it was like, I think
And I
we,
appreciated those people that were able to look at their own and give you input.
Mhm.
That I find is probably the most helpful part.
and the ones that like, the Futures Clinic, I mean, you can still have them go through and if things need to be changed, you can still even submit those because you haven't formally been to PAC. And so, you know, that kind of thing. So, okay. So if you find like misspellings or something like we did, you can just let me know and I'll make those changes for you. So,
Excellent.
okay.
Thank you so
And
much.
if you don't mind, I'm gonna take these few pages with me. You need this back?
No.
Okay, so.
Good.
You know, we are fascinating, Kim. You may want to hang around, but you know, you're perfectly welcome to leave.
Okay.
Thank
no,
you.
But, yeah, so, and if
Thanks for your
anybody
help.
has any questions, please feel free to email me over in the council office. So,
Thank you so much.
thank you.
Thank you.
Bye-bye. Okay, great. Syringe service program renewal.
Yeah, so we just need a vote.
Good, I was gonna say.
So this has been posted
Just
for
post-
the,
it just
for
needs to
the
be
30 days.
I'm gonna, we're paying it out of 1159. So we don't, since it's
Okay.
not the state
Oh,
money.
okay,
Okay,
cool.
do you want to?
So,
Yeah,
I'll move to.
Okay,
I'll
you're
move.
doing all the moving.
I'm moving and
I'll do
checking.
the second.
Okay, so
I'll
I'm
second
moving
too.
to approve the syringe service program
great.
renewal.
It's been moved and seconded to approve the syringe service program renewal. Discussion, no. All those in favor, please say aye.
Hi.
Opposed? Great. All right, new business. We have some grants to look at here.
So the renewal of the Greater Health Foundation of Indianapolis, that is the email that I sent to you, Dr. Pritchard and Aurora, and Dr. Britton, just to get an email verification that we could submit for that renewal.
I
So
gave you that information today on the.
so this is just an ongoing, do you want to speak to that at all? Okay.
This is a grant to the Health Foundation of Greater Indianapolis, and we have gotten this grant every year since we started the food service program back in 2016. They have given us more money than when we started, but they're one of our biggest supporters. And that's where we get money for the Indiana Recovery Alliance to use to buy syringes. So since this is from a foundation, it can be used, so they buy the syringes and then we reimburse them. So up to
Cool.
25,000.
I know we're up to a lot of syringes. Can you give us a bean count?
A P count from
Bean count,
a what?
a bean count.
Bean.
How many syringes are we going through?
I don't have the whole numbers for the Indiana, for the IRA, but with this grant last year in 2022, I think we did 264,000 syringes we purchased it, so.
That's staggers.
I looked at that today, that's the only reason I could pull that number just right away.
Wow.
600.
But I do want to say that our numbers,
643,000.
That's what it mentions.
600?
Earlier in the cover letter for the funding resources.
Yeah.
I remember 600,000 somewhere.
Okay.
Yeah,
It says so far this year,
The semi truck.
January 1st to September 30th, the program has given out 643,383 syringes.
Good Lord.
And our return rate on this though is around 75%, which is up there with everybody in the Heisman states.
That's
So
phenomenal.
nobody's doing better. than around
That's
75%.
phenomenal.
We're right there.
That's wonderful.
Great job. Okay, do we need a vote on that?
Goodbye, victim and
Uh,
fix
Yes,
and stop.
so
Okay.
new process, have to vote on all grants.
I move, we accept the renewal of the Greater Health Foundation of Indianapolis grant.
Okay, it's been moved and seconded.
I'll second.
I already seconded
It's
it.
already been seconded.
We can start it.
Gotta
I
speed
think
it
that was
up.
a vote for approval right there. All those in favor, please say aye.
Aye.
Opposed? Great. Check that one. All right, the new Medical Reserve Corps grant. You have anything to say?
Yeah, I can speak on this one again. NACCHO, it has a grant opportunity out this year for an operational grant for the MRC. So what we applied for is, it's just $5,000, but that's a little bit of money to kickstart the MRC again. So that, pays for training for people to come in and do things, maybe supplies. So it's not a lot of money, and I think they're only going to do 30 in the US, so there's not a huge chance. But still, we wanted to make sure that we applied, so.
Sure. Okay,
Is the application difficult?
No,
Or
it's in
lengthy?
red cap, so it's.
Okay,
pretty simple.
Okay, okay.
It
And
won't
you
take
said
up a lot of
5,000?
time. Pardon me?
$5,000.
Yeah, it's not a lot, but it's some funding, so.
Yeah, no, it's great.
So there were many years, like, I don't know, about 10 years ago, where that was the normal amount that the MRC got per year for organization, so we're pretty used to that amount anyway. We're used to working on the budget, right?
Mhm.
Public health.
Good.
So I'll move approval of the new MRC grant.
One second.
Strong enough to-
all right, it's been moved and seconded to approve the MRC grant. All those in favor, please say aye.
Aye.
Opposed, motion passes. All right, Path for You.
Yes, so we currently have this contract, but recently spoke with some individuals about amending this agreement to provide a flat $10,000 that we could help use for administrative fees, personnel. Essentially, they've obtained some extra funding that they're trying to disperse out to individuals to help them get their Path for You programs up and running. And so this would just be an amendment to approve that $10,000.
Sounds pretty straightforward.
I haven't received the contract yet, but
Okay, I move that we accept the new statement of work for Path for You.
And I will second it this time.
Oh, there you go.
Everybody's involved. All right, it's been moved and seconded to approve the Path for You, the new statement of work. All those in favor, please say aye.
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 Opposed? I prefer to call it the Nacho grant because I just like the sound of that. So
Mhm.
that's,
Mhm. One of the Commissioner Thomas emailed me information about this grant award. Just providing it for board review to see if it's something that we should consider applying for. Vaccination rates here in Monroe County are really good. So I think it could be challenging for us to get approved for this, but of course, happy and willing to do whatever the board and the commissioners would like.
Well, when I remember hearing from Aurora that there are only going to be 3 of these grants in the country. And it seems like an awful lot of work with very low possibility of grant approval and possibility. And we don't have that many people that it would really apply to. We'd have to go find them, dig under rocks. So in my mind, it really doesn't make much sense for us to put all the effort into this grant.
I completely agree.
Who, would you be the one writing that?
Well, yes, but ideally in this, for this particular grant, it would be best if we were to partner with another organization just for,
Such as,
well, I don't even know.
We'd have to,
Fine.
it seems like we'd have to go to another or multiple counties around us to their health departments, because that's where we're gonna see the lower vaccination rates.
Yeah,
Well, and when I looked at
Then
the
you can-
map,
And- but
we
they don't
have
have
to
the
go
personnel.
to Vigo County.
Yeah.
Essentially,
but there's only,
because that's the closest that has a lower vaccination rate.
Really?
So
Low.
not even super low, but low enough
Not
at least to
low.
qualify, but
I
it's
was gonna
like,
say.
no, green.
what-
No, I swear, I mean, I can find the map and show you guys,
Yeah,
but
there's-
I think I gave you a link to it, right?
Yeah, and I looked over the past 5 years and I mean, all very high vaccination rates.
Yeah, so I think for all those reasons, it does not make sense for us to apply. It's gonna be a whole lot of work for no reward.
sounds like it's.
Okay, so
Understandable.
I vote to oppose
yeah.
the writing of
It's
the
like, do
national.
we just say no or? Okay, well, we'll go ahead. Somebody can second that and we will, if
I will second.
it's been moved and seconded to not apply for the Nacho grant. Is there any further discussion on that? Then all those in favor of not approving the application for the grant, please say aye.
Aye.
Opposed?
That's one thing off your plate.
Yes.
All right, health officer contract and performance standards. Lori and Aurora and myself met with Dr. Britton, when was it? 2-3 weeks ago,
A couple weeks ago.
tomorrow. Was Friday, so it's almost like 3 weeks ago or something anyway. And we went through his contract, made a couple minor adjustments and wording. Basically didn't amount to much of anything on the contract, but we did go through some performance standards, which I think you have all had access to now. According to, it was Kim, we don't really need to vote on the performance standards, but we need to vote on the minor changes to his contract. Is that correct? Am I correct here?
I might ask legal.
I think
Really?
Molly,
Yeah.
well, I think we should vote, I think to be safe, don't you think?
Yeah, let's do it as a,
We should vote on
Or Molly,
everything
it wasn't
that
Kim, it
Molly
was
said.
Molly, thank you.
Because
Let's do it
Molly
as a-
took what we decided at our meeting and put it into the format legal wanted to see it in.
Mhm.
And so I think those standards are going to become part
part of it.
of the contract. So,
If I believe it's an amendment, like it's an appendix.
yeah,
but an
so I
amendment.
think we should be safe and just vote on.
Well, we can
the
vote
whole
on it.
smear.
I think that she actually,
It can't hurt us to vote on the whole thing as a package.
well, no, it can't hurt, but she sent me an email, they
Yeah.
said we didn't have to vote on the performance standards because those were things that we instituted as
But
things that expectations.
but it may mean that we
We'll
are
vote on it.
standing
We'll
with
vote on
it. Don't you think?
Okay, so and Dr. Britton, you don't have any objection to, do you have any comments regarding what,
The standards.
yeah, the standards?
Well, it's just, it's gonna be more of my time. To go to all these places. I gotta figure out how I'm gonna do that.
Yeah. I will say this, the performance standards did define what the contract actually said, right? Is that correct? I mean, that's what we,
Right,
yeah, so
although
we,
not all of that stuff is in the contract.
Right, I think none of that stuff is.
yeah,
Correct.
no, it's not
Almost
specifically
none of
spelled
it,
out.
yeah.
right?
And I don't know what has been the expectation in years gone by.
very low.
Well, the
It's my-
the expectation was that some of
there.
this stuff was getting done and it probably wasn't getting done, but, I don't think in my personal opinion, we shouldn't use the performance of what happened before as for what we'd like to have happen
I
in the
totally
future.
get that.
Yeah.
I just,
Right.
just curious.
And I think it doesn't serve any of us well to not have things explicit, because that way, we know, we can feel
And
like,
the public
we can
knows.
feel like we're doing our due
Right.
diligence. Nobody can come back at us and criticize that we're not.
Right, right.
Meeting
Yeah.
expectations that are also set out by the state for what they expect from the health officer.
And those are gonna change from time to time,
Right. Yes, they will.
you would think.
So do I have a motion to approve?
I move to approve the health officer contract, should I call it an appendix? And performance standards.
Second?
I'll second.
Okay, it's been moved and seconded. Any further discussion? All those in favor, please say aye.
I,
Aye.
Opposed? Does that include the amendment for the COLA?
I think the medical director contract was separate than the health officer contract, so I'm not sure the medical director contract was on here,
No,
and that's where the COLA is for this next year, correct?
where it went to.
the COLA on the here's what we discussed. The health officer contract, the COLA was, since it was negotiated 6 months ago, we would be doing a review at the end of 1 year. And then Dr. Britton, then the health officer contract would be eligible for the COLA at the traditional time that it was given, which is typically in January, which would be a year from this January.
It said in the documents we saw.
Now, the medical director of,
Futures.
who was also Dr. Britton, the medical director at the Futures Clinic, that contract has been in place for many years. So it was, I think, our feeling that contract would be eligible for the COLA immediately.
So do we vote on that?
Yes.
I mean, it
think so.
seems like we should.
Yes. It was,
I move
it's in
to
here somewhere.
accept the updated medical director contract to include the COLA.
In the futures.
And for the Futures Clinic. Well, that's medical director, not health.
So I'll second that.
Okay. Further
Discussion question.
Yeah.
Contract is different from county employees, I know that. Well, COLA, what is it based on? Is it based on what the county employees get?
Yes,
Is it
and it
yes.
based
says that
on-
in the
Yes.
contract.
Yes.
Okay,
So if they don't get a cost of living increase that year, it would not apply.
then I think that should be written somewhere.
It is,
It's in the
Okay.
contract.
it's in the
Okay,
amendment.
okay.
It's in the,
Because I
yeah,
thought it should define what,
it does.
It's in the amendment to the contract. It says that he would get it, the medical officer, medical reserve, and the health officer contract would get it if the county gets it. And it would be at the same time that they get it, which is typically in January of the year of that. Yeah, it's actually in that,
okay.
in there.
Yeah.
All right, so
Didn't want it
there's
to
a
be
vote.
based on the senior, what the seniors get for cost of living.
So we have a motion on the floor. All those in favor?
Aye.
Aye.
Opposed? Medical Reserve Corps.
Well, I wanted to talk this up a little bit. There's a flyer here if anybody wants to take it with them to go. So the Medical Reserve Corps is a really great group. As Christina said, they're volunteers and they participate in some of those emergency plans that Christina talked about. I've been on the Medical Reserve Corps for many, many years and participated in exercises, and it's wonderful. And so they're having an open house December 5th at the new library at 5:30. And I think it would be important, and thank you, Dr. Britton is going. I think it would be important for as many board members as possible to just show up and thank the volunteers and meet everybody. And I don't think you would be prohibited from also becoming an MRC volunteer if you would want to do that. So there's my plug.
Yep.
Good.
Thank you for plugging.
Yeah, I will be on
What
the other
time
side
is
of the
it?
earth.
It's 5.
Yeah, elevation.
Oh, you've got it right there.
Well, I see 265.
Yeah, it's
It's at the very bottom.
Oh, I
5:30.
see it, I see it, I see it.
At the library,
the
Yeah, the
new,
new
the
library.
new
It's the new
library.
library down on Gordon Pike.
Yep,
By Bachelor, Fullerton
It's
and
the
Rogers.
down
southwest,
by Bachelor.
southwest
It's a bachelor.
branch library.
At the roundabout.
At the roundabout just got,
Fullerton roundabout.
Just
Yeah.
past the roundabout going out of town.
the roundabout just got plants this
We have
week.
materials in here. It looks like that's the end of the
No,
agenda.
it looks
We have
nice.
materials in here though
You talk
about
about the board.
Path for You.
Yeah.
And I have actually 2 questions. If somebody can stand to answer them about Path for You. The first question is IFHC on board with this? And then the second question is, how are the STD tests getting paid for IUD insertions?
I can answer the first one if you want to answer the second. Because I just know that we get a flat rate for certain appointments. I'm not exactly sure, but I know that you guys covered it more in depth. IFHC is aware of it. Many of their other clinics are also within the past.
Okay. I just didn't want us, I didn't want us to be doing anything that they objected to.
I think that they specifically like Path for You to work with Title X clinics for the additional support with the free contraceptives.
Okay, okay. So
And-
who's paying for the STD tests for IUD insertions?
If they have insurance, we can bill insurance. If they're self-pay, either the grant will cover, I'm assuming, or it will be covered by the flat fee that we're given.
Like,
The sliding scale is incorporated, but I wasn't clear on what level.
Okay, my only concern was that it didn't come out of the STD budget, which while we're still in this period where we haven't got our mega bucks yet, I didn't want that cost going on the STD side.
And I think that we have, I don't think that that is a high concern, at least at this time.
Probably, unfortunately, won't amount to more than a couple of people, right? Hopefully not, I know, hopefully not, but thank you.
Okay, last thing on our agenda is the December meeting. The December meeting would be scheduled on the third Thursday, which is the 21st. How many people will be here and able to attend in person?
I'd really like not to. I mean, I've got like 12 children coming in my house.
Okay.
And it's
That's
the
when
day
you should
before my
leave.
birthday. I know, right? Oh, God.
Good point, Ken.
I know, I'm stressed already. So,
I was gonna say, if I can interject, part of that was because the 30-day rule that we're now under. I did post that. I spoke with Dave, the other day about, what exactly is the day and all that kind of stuff. It has been posted so that if you guys wanted to move the board meeting up a week to the 14th, we will be covered under that. So we'll have more than 30 days.
I would love to move it.
I
But
am available on the 14th, and I don't, but I'm also available on the 21st, so. Is there any will to? Is there anyone, is the 14th not going to work for anyone
I
else?
will only have one child and a grandchild here on the 14th, so
Yes, no,
That would work for me too.
Works for me.
Look.
Are we wanting to stay at monthly board meetings? I mean,
Well, we
in
really
January?
haven't had a choice up till now. I mean, we've had so many things to do.
And if we have more things to approve, especially that need 30 days notice, especially, I mean, it kind of seems like,
I
I'd
know
rather
it's a
keep
lot of
them-
work for you guys since we're having these every month, but you know, we really haven't had there really hasn't been an alternative. We've basically, for these job things, we've had to meet every month.
I'd
I
rather
will
keep it-
say this, in January, I will be gone. I will have to be virtual, so I may ask you to run the meeting if you could do that.
I'm gonna be virtual January and February. I get back in the 1st of March.
are we gonna have a problem with a quorum?
I thought so. I thought that virtual attendance day.
Well, you have to have a quorum in person, I
person,
think.
right?
It's at 50% in person.
Yeah.
And. if
1,
two-
2, 3, 4, 5. So we need
So-
2.5 people here, person.
Well, does that based on
It's your-
7 or based on the 5?
Based
that
on
is-
7.
Based on 7.
Based on 7?
So there's 7.
Well, we 7. That's so unfair, and we can't get
Well,
7.
That's the,
So then we have gotta have 4.
right.
So if you're both gone in January, you're gone in January.
No, I'm here.
I'm here.
Okay, you're both gone in January, we've only got 3, so we should not meet in
That's right.
January, we shouldn't even think about it, right? So that means you guys, you can't do any work.
Well, you might get your new appointments.
No, are you kidding? We're trying to get new appointments for a year.
Well, we haven't explored some of these things.
It's possible, yes, it's possible, yeah.
Oh.
So Dr. Britton doesn't count. He's
No,
technically
he's not a
secretary of the
board member.
board.
He's not a board member.
I'm not a voting member.
He's not a voting member.
Okay,
So in
All right, so
February, then Kay will be
let's,
gone, but you'll.
first thing first here, we are meeting on the 14th?
I think I can meet on the 14th, I think.
Okay, all right. So,
I can meet on the 21st, I know.
okay, so we need to, and we do have we can meet, the meeting can be short, I guess, but,
Yeah, well, we have the IU contract that we'll need to approve.
Yeah.
Mhm.
yeah, a couple of things we need to work
So
on.
thank you guys for moving that to the 14th. I appreciate it.
So it's definitely moved. Okay.
Oh, just the calendar.
Hasn't there been times that we didn't have a January meeting?
Well, there've been lots of times we
Yeah.
haven't had meetings at all
Yeah.
on many months.
Yeah.
We used to meet only once per quarter.
Well, when I first
Yeah,
joined the board, it was
4
4
times a year.
times a year we met.
Yeah.
Right.
Yeah, we just had a lot of.
That's
we've just
why I
been
was-
really
That's
busy.
but
why I
then
was
all hell broke
persuaded to
loose,
come on,
you know?
We only meet 4 times a
So-
year.
So the only other comment that I have is that I did look into parking, and the story is we can't get approval because we get a stipend. And if we were a board that did not receive a stipend, then they would consider
Of course.
giving us.
That's
access to
hilarious.
Oh, for
parking.
gosh sakes.
That's
So,
hilarious.
I thought I would get back to you.
Thank
I
you.
Well, you'll have more stipend money next year to. pay your
Yes, all
parking.
right, that's good.
Well, you know, that 50 cents in the parking garage is about to drive me.
one more comment. Dr. Britton and I did the podcast on Tuesday,
Oh,
the 15-minute podcast, and for our fans, it can be heard on WFHB.
And we did it in 2 takes.
Yeah, we did 2 takes, that's right.
Very good. Oh, I looked at the Bloomington Chamber of Commerce site at the beginning of the meeting. Even though they had recording cameras,
Yeah, we saw.
all they posted were a bunch of stupid photos. So it doesn't look like they recorded, and the talks were really good, I thought, didn't you
I
think it
don't know,
was?
but I'll contact them
good.
to find out
So
if they
sorry.
recorded anything.
It was really good.
I know.
I thought they did a good job.
Yeah.
Anything outstanding we should know?
Apologize.
You have to call VCAT to get that
No.
recorded, don't you?
Yeah, but if they do, I don't know.
Yeah, they do most of the recordings.
I think
But I don't-
VCAT has
but
to.
I-
Okay, do I hear a motion for adjournment?
So moved.
Amen.
Second. All those in favor?
Hi,
Aye.
thank
you.
you. Happy Thanksgiving, everybody.